Very good morning, student. This video will deal with what are the possible questions which an examiner can ask during your Viva or this practical examination on the anterior view of the skull. If he will give you the skull, okay, and will start asking about the anterior aspect of the skull, then there may be many questions. For example, when you are looking at the anterior view of the skull, then he will ask what are the openings on the anterior view of the skull. Naturally, there are many openings are there which are important. You can see that superiorly there are two sockets or two big depressions are here, or fossas are here, which are called as the orbit, and this orbit they give lodgement, or this where the eyes are there, okay, eyes they rest there. Then in between the two orbit and inferior to this, there is a triangular opening is seen in the midline, and that is the nasal aperture or opening of the anterior opening of the nose. And then here there is a big opening between the upper jaw and the lower jaw, that is mandible and maxillae, that is called as the oral cavity, opening of the oral cavity. Okay, so these are the three large opening you can always mention if he is asking what are the opening. Then naturally the another question which are to be asked is that name the bones which are forming the anterior view of the skull. You can name as that on the top, okay, or above superiorly there is a single bone, okay, which is forming the forehead of an individual, okay, and this is called as the frontal bone. This also forms the upper border of the orbital opening or superior margin of the orbit. Then there are two bones which are present on either side of the midline, which are plate like bone where this pointer is moving. You can say these are called as nasal plates, right and the left nasal plate, and the suture between these two is called as internasal suture. Above these plates are articulating or making another suture with that of the frontal bone, better seen in this illustration. You can see that the upper end of the nasal bones or plates, they are articulating with the maxilla, and this is the frontal bones. Then on the lateral side there is two bones are seen here, because on either side of the midline these bones, these are called as maxillae, or this is right and the left maxillary bone, and this maxillary bone encloses along with the nasal plate this triangular anterior nasal aperture or anterior opening of the nose. Then on the lateral side of the maxilla, you can say that these are the bones which forms the prominence of cheek, okay, which are seen here in blue color, is called as zygomatic bone. And then below this maxillary bone, this is a single bone which is called as the mandible, okay, which forms the lower jaw and bears the its cellular process bears the lower teeth. Maxillae, they bears the upper teeth. So these are the two jaw, upper jaw and the lower jaw, formed respectively by maxillae and the mandible. Okay. Now, beside this bone which are seen in from the front, there are some bones may also seen behind. Okay, on lateral side, this is the parietal bone where the this pointer is there, and in the yellow color the bone which is there, it is called as part of the temporal bone is there. Inside the orbital opening you will see many bones which I will take separately when I will take the Viva on the orbital cavity itself. Okay, but this completes your question, answer to the question that what are the bones which take part in formation of the anterior view of the skull. Then he will naturally ask another question, what are the important sutures on this view? Then you can say this is the midline suture which we already noted, internasal suture. Then this is a midline suture between right and left maxillae, and this is called as intermaxillary suture. Then there is a suture between the maxilla and zygomatic bone, what is called as zygomatico-maxillary suture. zygomatico-maxillary suture. The upper process or the frontal process of this zygomatic bone forms an articulation here on lateral border of the orbit, and this is frontozygomatic suture here, this suture. Frontozygomatic suture is there. There is no suture present in the mandible because mandible is a single bone. It is a single bone. Then next question may come, what are the different foramina you are seeing on this aspect, that is anterior aspect, and what structures they pass through it. Here you can see that most important foramina which is seen is near the lower border of the orbital opening, and this foramina where pointer is moving is called as the infraorbital foramen. It is a part of the infraorbital canal or anterior opening of the infraorbital through which passes the infraorbital nerve and the vessels, okay, which are terminal branch of the maxillary nerve here. Then there will be a notch sometimes seen on the superior border of the orbit very close to the medial side, and this is called a supratrochlear notch or supratrochlear groove here. See here one notch is seen here. This may be the supratrochlear or it may be supraorbital also. Sometime instead of a notch there may be a foramina here, and then you can say that it is supratrochlear notch and supraorbital foramina which gives passage to the supratrochlear nerve and supraorbital nerve and vessels of the same name, which are the branches from the ophthalmic nerve. Okay, the fifth cranial nerve, the first division, the ophthalmic nerve. Then there is a foramina here on mandible here where the pointer is moving, and this is called as the mantle foramina, which gives passage to the mantle nerve, which is a branch from the inferior alveolar nerve, branch of the mandibular nerve. So inside the nasal aperture you are seeing the two different colors, okay. The yellow color bone which is seen through the anterior nasal aperture is the part of the ethmoid bone, perpendicular plate of the ethmoid bone in midline, and on the side it is the middle concha is there. And then another bone is seen here lower down on either side. This is the inferior nasal concha, okay. That we will learn when I will teach you the Viva on the nasal cavity, okay, on the nasal cavity. So that in midline this structure which is seen is the median nasal septum formed by the two bone. Above is the ethmoid perpendicular, and here lower down this with other color shown here is that of the vomer bone. It is the vomer bone. So these are the usual questions which are asked in the Viva of the norma frontalis. I hope that you have understood that, and while you are just attending my these lectures on to the Viva on the skull or the head and neck bone, please sit with the bone with you if you are having, or at least open the diagrams in your books or atlas. Again, I will say that I am thankful to Walter Kluwer for using these illustrations, and I am also thankful to you for watching this video on to the frontal view or the anterior view of the skull. Thanks.